Alright guys, today we're gonna watch this video from this YouTube channel that I like to frequent. This guy, Dr. Bernard, does a bunch of different case studies of unusual diseases and presentations. This one I found kind of important to share with everybody because it talks about the dangers of Benadryl, and this can also apply to any other first generation antihistamine or any antihistamine, as in Allegra, Zyrtec, or anything like that. Commonly we take these medications for sleep aids because one of the side effects of an antihistamine is sleep, but it's a side effect because histamine receptors are all over our body. And in this case that we're about to watch, we're going to actually see exactly where they all are because they all become blocked in this case. So it also shows you the dangers of internet social trends, that if people on TikTok are doing it, you probably shouldn't do it, no matter what it is. Just anything, don't do it. But we'll kind of cover the science of the medication in the body and kind of see why this stuff happens and why I no longer take Benadryl for sleep aids. So let's get into it.
Hi, Dr. Bernard here. Don't do this. Just because Benadryl's over the counter doesn't mean it can't do bad things. Even taking it as directed for allergies often nets people a dullness and mental fog that lasts into the next day.
Benadryl Hangover.
JC is a 21-year-old woman presenting to the emergency room unconscious. Her dad, Scott, tells the admitting nurse that she had at least 3 seizures in the past hour. The last one went on for more than 15 minutes before he saw his daughter fall limp like a rag doll. You see, JC was a regular college student in 2020. She had just finished her finals, although she had already moved back home earlier that spring because of pandemic. This summertime break was a good chance for her to pump up her internet following. With TikTok being the favorite of all her friends, she was going to become internet famous. A small trend was growing over the weekend, #Benadryl Challenge. This is going to be something big, she thought. Back when she still had classes in person, she heard about Benadryl being able to open someone's mind. Some of her friends had tried it on the weekends. She thought she had tried it during her freshman year, but couldn't remember. She couldn't really remember anything from that year. Haha, TikTok meme, she thought this time around as she danced around on camera with 2 whole bottles of Benadryl before dumping them into her mouth. And immediately after finishing both bottles, JC...
So, the regular dose for sleep aid Benadryl is about 25 milligrams. Really, and then if you're having severe allergy symptoms, which present as hives, and then progress into anaphylaxis, which is swelling of the soft tissue of your oral pharynx, or your mouth and your airway, Benadryl is not necessarily the first line. If it gets to that point, we want to use epinephrine or adrenaline IV or IM with an EpiPen, and if the EpiPen doesn't work, then we'll start an IV drip of 1 microgram a minute, and then that should guarantee to cure that. But we also dose Benadryl, because Benadryl, the antihistamine receptor on the mast cell, which is an immune cell, and that mast cell secretes histamine, and histamine dilates your blood vessels, causing more blood flow to get there, but it also causes the swelling of your soft tissue. So that is the main reason, and pretty much the only reason, that we should use Benadryl. Because as we see in this video, we get kind of see where all the receptors are when they stop working.
She didn't really feel anything. She was going to be famous now. She was going to get 10 million views. Allergy medicine go glug glug, she thought. And what she didn't realize is that the dose of both bottles combined can be fatal. As the hour passed, JC could feel a burning sensation at the base of her neck. Her ceiling became like jello, wobbling around. But ceilings are cringe. I'm floor gang now, she thought. Always have been. JC had never felt more relaxed as she turned on some music. She could hear people chanting her name over the speakers. That's the sound of being TikTok famous, she thought. She tried recording more videos of her trip, but eventually she forgot what she was doing. Her vision was blurry, but she didn't need her eyes to see anymore. There was a drum beating faster and faster in her chest. Her mouth was like a desert, devoid of water, and her teeth were like giant stones grinding each other down into sand. JC looked at the clock. 12 hours had passed. Her dad had come in and asked her, "How much Benadryl did you drink?" But she wasn't sure if that was a hallucination or not. She said she took 10 million, which is how many TikTok views she'd get as she suffers her first seizure. In reality, no one was around. Her dad hadn't seen JC since hours before she took the Benadryl as she falls unconscious on the floor. As Scott walks in on his daughter, he sees her suffer her third seizure. While he called 911 and while the ambulance was on its way, JC's seizure wouldn't stop. But when paramedics arrived, she fell limp. Her dad had no idea what happened as she arrives to the emergency room, where we are now. At examination, JC was unresponsive. She was flushed, but she didn't have a fever. Her heart rate was 180 beats per minute, about 3 times more than normal, but her blood pressure was 70/40, about half of normal. No one there had any idea that JC had...
So the reason for that is that you're going to have some, looks like kind of like an anticholinergic type of response, and your cholinergic or your acetylcholine is being blocked as well, causing a fast heart rate, but the dilation of all her blood vessels is causing her to have a low blood pressure. So that's not good. That's why she's presenting that way.
Taken 2 whole bottles of Benadryl, but there's a few clues as to what could be happening. JC's skin was red, but she wasn't sweating. Her pupils were dilated and were minimally reactive to light. Her mouth was dry, just like all her mucous membranes. Her heart was beating fast. All of this together signals anticholinergic poisoning, but what does that mean? What is a cholinergic? And what does it have to do with Benadryl? Well, Benadryl is an allergy medicine. Its chemical name is Diphenhydramine. Lots of people take it in the spring when the flowers are blooming. Pollen and allergens cause people to sneeze, to cough, to have a runny and stuffed nose. The body thinks these allergens are foreign objects that need to be removed. What's a good way to remove things? Well, you could dilate the blood vessels and make them more leaky in the hopes that the allergens will leak out. Benadryl stops this allergic reaction by stopping the signal for it, which is from a natural chemical that's made in your body called histamine. Hist from histidine, which is an amino acid, a building block of proteins in your body, and amine referring to nitrogen, which is a base word for amino acid. But if Benadryl is just an over-the-counter medicine, why did it cause JC to hallucinate? It's not like you're stopping allergies in the brain. And why is her heart beating so fast? As the doctors keep examining her, they find that she has a pulse, but her heart is beating in a way that if nothing is done about it, her heart will just shake in place and won't be able to produce an actual contraction. Doctors shock her into a normal heart rhythm. And after this happens, JC's dad realizes that his daughter had posted some TikTok videos of her drinking 2 whole bottles of diphenhydramine. He shows this to the doctors, and it tells them everything that they need to know. Diphenhydramine inactivates histamine receptors. It doesn't stop the immune system from releasing histamine, it stops your body from interacting with it. When you take the dose on the instructions for allergies, this inactivates enough of the histamine receptors so that you don't have a reaction. But if someone takes too much, like let's say 2 whole bottles, then that person's going to have a lot of diphenhydramine floating around in the body, meaning it's going to interact with more than just histamine receptors. But what else would that be? If you've ever taken diphenhydramine, you know it can make you sleepy. That's why it's branded as a sleep aid, too. Some parents give it to their kids before a flight so that the kid will sleep on the plane and not cause a ruckus. You shouldn't do that to your kids. But if you've ever taken it for sleep, you know you don't wake up feeling great. All of this means that Benadryl acts on the brain, which is clearly what it did to KC, because as doctors transfer it into the intensive care unit, she suffers her 4th seizure. Nurses had to give medicine to stop the seizure because it wouldn't stop on her own. The Benadryl deposits not just in her brain, but in all her organs because she took so much of it. This brings us to an idea called lipophilicity. Lipo meaning fat and philic meaning affinity for. Benadryl is lipophilic, meaning it dissolves in fat. We know water doesn't mix well with oil, which is a fat. Outside of the cells in the human body, there's a bilipid layer, meaning that your cells are coated and defined by a layer of fat. This would mean that a lot of Benadryl doesn't want to be in the blood because blood is mostly made of water. It would want to be in the cells so that it can interact with that bilipid layer. And more than 60% of the brain is made of fat, which is how Benadryl would get in. Do you remember those histamine receptors? Well, they're not just in the lungs and the skin to cause an allergic reaction. They're also in the brain. And while histamine can cause blood vessels to dilate and become leaky elsewhere in the body, in the brain, it does different things. It regulates sleep and wakefulness, so if Benadryl is there, cells don't respond to histamine anymore, so there's no more regulation and no more wakefulness. And that's how it causes drowsiness. Histamine is also involved in cognition, so if Benadryl is there to block it, then there's less cognition. Less cognition could mean more hallucinations, which sounds a lot like JC's case. Histamine is also an anticonvulsant, so if Benadryl is there to inactivate it, then there would be convulsant activity explaining her seizures. But she doesn't just have a little bit of Benadryl in her body, she has 2 whole bottles of it. But if it's sitting in her organs, blocking all the histamine receptors, and there's still a lot of it floating around, what else would it block? This brings us back to anticholinergic poisoning. A cholinergic refers to the naturally occurring chemical called choline, which happens to have a similar structure to Benadryl. One part of the nervous system signals for rest and digest. This is mediated by the chemical acetylcholine, which is made inside your body, and cholinergic receptors take in acetylcholine to promote rest and digest. But interestingly enough, since we've sequenced the entire human genome, we know what the DNA in our body makes. Nature likes to conserve things, and our genome tells us that almost half of this cholinergic receptor is just like the histamine receptor. And because Benadryl isn't too different in structure from choline, then it means having a massive amount of Benadryl in the body would cause it to bind to cholinergic receptors too. And a lot of Benadryl means a lot of these cholinergic receptors don't get acetylcholine anymore, they get Benadryl instead, meaning that JC's body can't signal rest and digest either. Without a digest signal, her mouth becomes dry, so no more saliva. Her stomach muscles don't move anymore. She becomes flushed, but she can't sweat. She can't and hasn't urinated since she took the whole bottle of Benadryl. Her pupils become dilated, and her heart doesn't slow down, it speeds up to the point where it shakes in place and doesn't actually produce a contraction. In the intensive care unit, doctors give medicines to try and stabilize her heart rhythm. Benadryl doesn't just stop the histamine signal, it doesn't just stop the rest and digest signal, it also blocks sodium going into heart muscle cells because the other part of its shape happens to fit in those receptors in the heart too. And because JC took a huge amount of it, there's enough extra floating around to block anything where it can fit. Is there any way we could have...
So this is a really important part. When it says that it blocks the sodium channels, I don't know if this was actually a real EKG that they showed, but when you stop the sodium transport in a cell, it's called a sodium potassium pump. So it exchanges sodium for potassium. When you have a depolarization, you rush sodium in and you squirt potassium out to counterbalance the charges. They're both positive. In the heart, this is a very delicate operation, because too much potassium in the cell will cause for the heart not to be able to depolarize, meaning you're not going to get a good, fast electrical current. And if you look at this EKG, which I know some of it looks like hieroglyphics, as it should. If you don't study this, it doesn't make any sense. But you've all seen the pretty much textbook picture on ambulances or necklaces of the EKG machine, the QRS complex. It's just a G thing, but it's very sharp, and in this case you can see it's widening out. And this, whenever we see it in an EKG, somebody comes in the hospital with an EKG looking like this, it is pretty much hyperkalemia or high potassium until proven otherwise. This is never good. When that QRS or that up and down thing starts to widen, that's the first sign of a high potassium. You'll see high T waves. So the T wave is usually this small round bump that comes after the QRS. It'll start to peak. That's when potassium gets around, the low 5s. When the QRS starts to widen, it's getting even higher than that. And then once that widens, you're going to go into a ventricular fibrillation. This is going to go into a dangerous rhythm that will degrade into asystole and death. Basically, once the heart stops and you flatline, there's not much we can do from a resuscitative point of view. You correct the problem, but you do not shock a flatlined heart. You just do CPR, and protocol gives epinephrine to see if that'll jumpstart it back up. But this is clearly a hyperkalemic EKG. They shock her into a good rhythm, they said. What you can also do to replace hyperkalemia is you give the patient insulin and sugar, and insulin and sugar will stimulate the pushing of potassium back in the cell. So with this, we said that antihistamine is blocking that sodium-potassium pump. So it's not allowing sodium to go in and potassium to go out, so potassium is just building up. And that creates a membrane potential that doesn't allow the heart to fire. So you would give potassium or insulin and glucose. You would give albuterol, at a high dose. Albuterol pushes sodium or potassium back in the cell, and you would give calcium chloride or calcium gluconate, but per weight, calcium chloride has more calcium ions. And what calcium will do is stabilize that membrane. So once you see that QRS starting to widen, you give calcium, you can literally watch the EKG change in front of you. But, if you're having this, basically sometimes hyperkalemia you look at it and you don't know what it is because it doesn't follow any pattern. And if that's the case, you're like, I have no idea what this is. It's probably hyperkalemia. Dr. Corey Slovis out of Vanderbilt, he does the 5 rules for everything, and hyperkalemia is one of them. Malmat 2 out of the University of Maryland does a EKG class where he talks about, if it's just crazy, then it's hyperkalemia. So, we don't learn about this in school, Benadryl causing these effects, because we never really spent time on the non-dangerous drugs. But every drug is dangerous at concentrations because we literally have histamine all over our bodies. It causes different effects for different places. Same thing with, adrenaline receptors or hormone receptors. In one spot they do something here, and in another spot they do something else. So, unless you're just an expert in that drug, which none of us are, then you can't really assume that you know what's going on. So, let's go back. Sorry I took too much time on that, but that's the important science behind this. So, where was it? Lipophilicity, sleep it dirty.
Can interact with that bilipid layer, and more than 60% of the brain different things, which sounds a lot like JC's case. Histamine is also an anticonvulsant, so if Benadryl's there to inactivate it, then there would be convulsant activity explaining her seizures. But she doesn't just have a little bit of Benadryl in her body, she has 2 whole bottles of it. But if it's sitting in her organs, blocking, flushed, but she can't sweat. She can't and hasn't urinated since she took the whole bottle of Benadryl. Her pupils become dilated, and her heart doesn't slow down. It speeds up to the point where it shakes in place and doesn't actually produce a contraction. In the intensive care unit, doctors give medicines to try and stabilize her heart rhythm. Benadryl doesn't just stop the histamine signal, it doesn't just stop the rest and digest signal, it also blocks sodium going into heart muscle cells because the other part of its shape happens to fit in those receptors in the heart too. And because JC took a huge amount of it, there's enough extra floating around to block anything where it can fit. Is there any way we could happen to pull it out of her organs? Maybe, but in most cases, this is treated by waiting it out. Give medicines to stabilize her heart, give medicines to stop her seizures if they happen, ventilate her so that a machine breathes for her because she can't do it on her own. But maybe, just maybe, there is a way we can exploit the chemical property of Benadryl to treat her, bringing us back to lipophilicity. If Benadryl dissolves in fat but not water, could we somehow infuse fat into her veins in the hopes that it would pull out Benadryl from her organs? At this thought, doctors infused the lipid emulsion used to feed critically ill patients intravenously. JC's heart rhythm didn't...
And this decision, hopefully, somebody in your department is educated in this, but most of the time once we find out what the culprit is, poison control is called for almost anything that's an overdose. And they're experts on this. So they will kind of, if you don't know, they will dictate the treatment, and even if you do know, you still call. Carbon monoxide is one of those. We kind of know what the treatment is high-dose oxygen therapy, but we call poison control, and they kind of guide us on that as well. Natural gas exposures. Use your resources that you have, because it's always going to help you if anything goes wrong. You don't want to be saying, well, I could have called. So you just do it anyway. And in this case, if you didn't know, poison control would be like, all right, you got to give this. So kudos to those doctors, either knowing from the start or knowing which resources to utilize. So it's not always about what you know. It's about finding out the answer, saying, I don't know, but I need to look. If you say, I don't know, and give up, then you're not doing your job.
Didn't change after the first infusion. It's still unstable. 20 minutes later, doctors infuse another bolus in, and then her heart stabilizes. Throughout the duration of her stay in the hospital, she never has another abnormal heart rhythm. In several case reports of this intravenous lipid emulsion therapy for various toxicities, a positive inotropy was observed, meaning that after infusion of fat emulsion, the heart beats stronger and harder. It's possible that it could be the kind
of goes into the ketogenic diet, the heart lows ketones, so that might be it.
heart muscle changing energy source from glucose to fatty acid from the emulsions, but it could also be the additional volume in the blood stretching the heart and causing a rebound reflex, or it could just be because the toxicity has been reversed. That's the good part. Sometimes that bolus of fat can cause pancreatitis because the pancreas is supposed to help break down fats, and it can also cause acute respiratory distress. That would be the bad part. But in this case, JC turned out okay. And on day 3 of hospitalization, she pulled out the tube that was down her throat. Confused as to where she was, her dad explained to her everything that happened as she realized that the TikTok fame wasn't worth the memes, especially since she had a mental fog and haze from the event for several months afterwards.
Wow, several months.
Viral following is almost never worth it, because fast up means fast down. Brightest stars burn out the fastest. Thank you so much for watching. Take care of yourself, and be well. Hi.
I thoroughly enjoy this gentleman. Not only is he a great doctor, he's a smart person, but in all his videos what he does is explains every word that he uses. So he doesn't just use a scientific word or Grey's Anatomy word and leave you at it. Either know what it is, pretend like you know what it is, or have to go to sending. He'll explain it out to you, and I find that very good. I think more of us need to start doing that. Stop holding medical science hostage to those privileged enough to go to school. Everything that we learn is all fact, and everything we learn is all available on the internet. All medical school really does is guides us to what information we need to learn. I hardly use my lecture notes, but I would use them as an outline of where I need to go seek information. I'm a very visual learner. Videos like this help me study. Khan Academy, MedCram. I think we did that MedCram video earlier on vitamin D. And so a good teacher is somebody that can not only just tell you what you need to know, but tell you in a way that you're able to understand. For me, dumb pictures and cartoons and analogies help me understand stuff like that. Even in like the most scary subjects of biochemistry, organic chemistry, if I can understand it in a way that applies to everyday life, then it works out. So with this video, I think the points to take home are Benadryl is really weird. So its side effect is the action in the brain that causes drowsiness. But it doesn't always cause that, because it can cause alertness. I remember when I was a child, Benadryl would actually speed me up. It's acting on different receptors. It's acting as anticholinergic, which the mnemonic there is hot as a hair, dry as a bone, mad as a hatter, I think. So you're just really hot, dry, stiff. Atropine blocks the muscarinic receptor in the heart where the vagus nerve is, and that nerve sends an impulse to slow the heart down. And if that's blocked, then the heart's just going to beat faster and faster with no regulation to stop it. This is why we see with some heart transplant patients that they have to avoid certain exercising because they don't have that ability to hit the brake anymore because they removed the vagus nerve during a heart transplant. We give atropine to organophosphate poisoning. So organophosphate is a cholinergic drug found in pesticides. So if you're a farmer or anybody working in a field around pesticides, where I went to school, some of the locals would poison the street dogs with this. And it causes increased salivation, basically the opposite of anticholinergic. So you're stimulating think of cholinergic as rest and digest, so you want to secrete the juices, slow down everything. And so it just slows down the heart because it's pushing on that heart brake. It causes you to salivate, you're just leaking fluids, you're tired, and it's a dead drink because it'll stop your heart. So that's kind of what we would use an anticholinergic for to treat this. But everything's in a fine balance. So she's having seizures because histamines act as an anticonvulsant, which may be good if you're having an allergic reaction. If you're getting brain swelling, this could help that. So the histamine not only causes the swelling, but it protects against some of the bad things that swelling can cause. Their body has so many checks and balances, and as doctors and scientists, we learn ways to manipulate that, but we also got to know that there's cascade effects of what we do. And if we don't appreciate those, then we can get into some trouble. You always gotta, I think it was my Dr. Goldfleece, which said, a good surgeon isn't determined by how well he can do a procedure. It's by how he can get himself out of a procedure that goes bad. It might have been Dr. Simpali, but both of them were amazing guys when it came to my medical education. But yeah, it's not how well you can do something right all the time. Everybody can do that. But when something breaks, how can you fix it? So a lot of the medications we give have side effects. People respond to stuff differently, and you just need to be aware of the possibility that that can happen, that you are a human being and will make mistakes. And as long as you have the best will for the patient in mind, then it's okay if a mistake happens, as long as you're expecting that to happen and you know what else to do. And part of that is staying educated and staying current and understanding these things, or learning from your mistakes. If you said, well, nobody knows this, I don't need to learn that, and you just want to protect your ego, then you're going to kill somebody else later on. It's okay to make mistakes. You just got to learn from them. If you never make mistakes, we'd never learn. We'd still be cavemen, dumb in a cave somewhere, because life would be great and we won't need to learn. So that's the thing to take away from him. If you want to watch any more of his videos, it's CHUBBYEMU, Chubby Moo. But yeah, this is great videos. There's so many interesting cases, like TikToker drank a liter of cough syrup. Man ate 500 vitamin C or vitamin gummies. All this kind of stuff. So we may watch some more of those. But yeah, so hope you guys enjoyed that, and we'll end it there for tonight. Maybe I'll go to sleep. Awesome. Oh, and don't mind the face paint. I didn't do that to myself because I was bored. Having COVID break. Someone did it to me.